All right, good afternoon, everybody. I hope everybody had a nice lunchtime break. My name is Eric Pauli. I'm one of the co-moderators for the session. Joining us via Zoom right here, the talking head on the screen is Dr. Ellie Schulman, who couldn't make it, but we decided that we would bring her. If you guys have ever seen the TV show Futurama, this is as close to heads in a jar as I think you're going to get. And then our other co-moderator, Dr. Moore, could not be here today. I want to frame a little intro to our debate. This is, as a reminder, the great debate session, Flexible Endoscopy, what is the right way to manage this sleeve leak endoscopically? So let's just briefly discuss. These are my disclosures, which will have nothing to do with the intro that I'm about to give. Let's paraphrase George Orwell. All sleeve leaks are equal, but some are more equal than others. And I think that we've all, as surgeons or endoscopists, seen patients who have sleeve leaks. And we know that there is not a one-size-fits-all solution. If there was, we would not be having a great debate. And so what I hope you guys get is maybe some answers to a clinical scenario like this. So a 35-year-old otherwise healthy patient gets a sleeve. They have a small contained leak noted early on post-op day 1 because they had some low-grade tachycardia. And I want you to think about how you might endoscopically address that patient and how that management strategy might change if the patient's BMI was, for example, 65, or if they were, age was 65, or if they were unhealthy or had a BMI of 60, or had a large leak, or maybe it was poorly contained, or maybe they were not otherwise healthy. And what if it was day 14 and not day 1? What if it was day 140, all right? And so what I hope you see in the next hour or so with our presenters is options for managing these, and I hope some thought process about which option to exercise in which patient. Our panel, I'll ask them to come up and give their talks and maybe stay up here afterwards so we can answer some questions at the end. Includes Dr. Eleanor Fung, who'll be talking about endoluminal stenting, Dr. Sabrina Noria, who'll be talking about internal drainage and endoscopic septotomy, Dr. Stephen Leeds, who'll be talking about endoluminal vacuum therapy, and then finally Dr. Michael Ujiki, who'll be talking about endoscopic closure of leaks. Again, take-home points from my perspective. I hope that we all learn a little bit about decision-making. You know, what are the thought process that these surgeons put into making a treatment plan? When would you convert from one treatment plan to another? And then if you're going to learn how to do this because you don't do any or many of these methods, what's a great place for you to start? What kind of a sleeve leak might you tackle first? So with that, we'll start. I'll ask our first presenter, Dr. Eleanor Fung, to come on up and give us a lecture on when we should be stenting patients.